Good morning, good afternoon, good evening, colleagues. I would really like to share why I think hands-on working with your hands-on children is really important. I was challenged by a colleague named Ginny Paleg, who many will know, after she had been challenged to describe why she believed in hands-off therapy. And her presentation can be found online. Now, when I watched that, I reacted and fundamentally do not agree. So talking to her, her reaction to me was, well, tell me why and give me some research behind why you think you should be working hands-on. And if not, change your opinion. Well, I promised to react. And this is it. The background, the research and the reasoning behind why I think hands-on is a must. I'm a semi-retired physiotherapist from the Netherlands, and I have worked in a number of countries. At the time, we were really trained to help children with their body structure and their body function problems. We were trained to use massage, all sorts of exercise techniques, electrotherapy, all sorts of modalities to help every patient reach their optimum physical possibilities. And that was long before this whole ICF started to be classified. And but now that we all use this, to me, our work has always been body structure and function as physiotherapists. To me, the occupational therapist is more the person that works with the activities and often also helps change the environment and help the child adapt. And of course, in countries where OTs were not that available, sometimes physios would take on a part of that work, but it wasn't our first priority. Now, the challenge behind this challenge is that it's not going to be easy, because even though we agree that we have the best profession in the world, we communicate quite differently, from being very precise and clear to being very nuanced and sophisticated. And in some countries, challenging a colleague is not done. It's never an option. In others, it's completely normal and appropriate. So that is why I would like to tell you a little bit about the book called The Culture Map before we go on, by Erin Myers. Definitely something you want to read if you talk to a lot of colleagues all over the world, because we evaluate, we agree, we disagree, we decide, we lead, we trust extremely differently per culture, and of course per person as well. And I was raised in two confrontational cultures, Australia and the Netherlands, but I also lived in Spain and Belgium. And when I came to Spain, I thought I knew quite a bit. And I would, probably share all my knowledge with all my colleagues. And I got my lesson in humility, because I found out that what I'd learned was only that much. And that was lots to learn from other cultures as well. And in these past 15 years, I have regularly communicated with colleagues from all over the world. And there are colleagues out there that will not confront ever. So if an experienced colleague or an elder is giving their opinion, the reactions can be really different, from criticizing to debating to respect and to no response at all. And that could be because of disdain, because of disbelief, even impatience. There's all sorts of reasons why people won't respond. But my aim for today is to respond to this challenge and to speak up about skin, and why I think it's extremely important to learn more about skin, and that we are the lucky ones that are allowed to touch. So let's please use that. Why is skin important? Well, first of all, it's our largest organ. It's our largest sensory organ. It's our direct contact with the brain. It's a tool of communication. It senses the outer world. It can show us the state of homeostasis and emotion of the person. And if you can't move your skin, you can't move. my awareness of the importance of touch started early in my career, as a matter of fact, as a student, because one of the methods we learned was the Bindegewebs massage by Dicke and Tyrich Leuber, a method of working in skin and what was called connective tissue, would actually give vasovagal responses, and meaning people were sometimes hesitant to use, and if we did practice too much on each other, we'd actually become ill. Also, the awareness that we are electrical beings, something that you learn slowly but surely in your career. It's the awareness of having touched thousands of people, having studied the skin intensely and knowing that our brain can be regarded as, our skin can be regarded as our outer brain. Courses I took with Crystal Heidemann showing me, and later on I could see that in my patients as well, that little pieces of silk with a specific color could have immense reactions, physical reactions in the body. Diana Jacobs' work, Professor Fukui's work, I'll talk about both of them later, and slowly but surely the awareness that the epidermis was actually the only part of the body that we are touching, and that if I use tape, and I developed the skin approach to taping, if I use tape, I can use it as a sensory stimulus. And I do wonder, why on earth would we even want to go hands off? We need interpersonal touch. Gentle touch is a therapeutic intervention. By gently touching and pulling or pushing the skin, we can initiate a movement direction. And light pressure can also be very helpful for a person. So stretch, light epidermal stretch, is a therapeutic intervention, as interpersonal stretch can be very beneficial, and allowing patients, your children, to touch a surface or another person or another object with one fingertip can be very, very beneficial. And keep reminding yourselves it's the outer brain. Give it the right information and it will do what's needed. So the whole hands-off, hands-on discussion has been going on for a while, and it started in sports and in the adult world. And this study has really looked at it because there's been a divide, and we've been a profession of touch from day one, but there is this divide, and division is never good. So the suggestion of the people that did this study was actually we need to rebrand therapy, because yes, we can't completely never do touching again. We can't go hands on all the time. So they wanted to rebrand, but I would suggest before doing that, let's learn a lot more about skin and then make a decision. Because when you think of it, there have been methods that, especially used in pediatrics, that have been around for hundreds of years, seriously, hundreds of years. And if they'd been that bad, they would have been banned a long time ago. And then again, these methods are the ones that I've written down. Please keep in mind, I only know what I know, and I'm not aware of what I don't know. So there probably will be, definitely will be more that I don't know of. So people, share your information, please. And then our Novak article and the traffic lights and the whole discussion that has started. Yes, the article is not the personal opinion of the authors. It's a summary of the best available evidence for treating CP. The problem with the article is it doesn't only discuss physiotherapy options, but also medical. So we have to grade them out. There are, as everybody, I suggest everybody read this article, because the articles that are considered, or the treatment options that are considered not worth using or don't use at all, are Voita, NDT, cranial osteopathy, hippotherapy, sensory integration, sensory processing, and massage. I have a problem with that, because a number of these things I've been doing my whole life and have had some really nice results, so I'm not going to stop with them. And the other thing is, when we think of it, systematic reviews do leave out a lot. The randomized controlled trials often leave out children with the GMFCS levels 4 and 5 and those with profound learning difficulties, meaning that this state of the evidence is for certain children with CP, not all of them, by far. So we have to be careful when we think of this. And you could wonder why we're not finding sufficient evidence. Could it be that people are not looking in the right places? They're not looking at all the literature in other languages? And if they aren't, why not? Have the right questions been posed? And coming to think of it, if I have been trained in one method, will my colleague trained in the same method be doing it in exactly the same way or not? I'm not so sure. And who decides which is the correct way to use? When you review evidence and look at the authors and where they come from, most researchers come from 10 mostly rich and Caucasian countries. The countries that have enough money to pay and fund research. There are 195 countries in the world. I'm sure there must be really good ideas out there that we just don't know about yet. And I miss, in systematic reviews, I miss the clinical experience and the patient option. So these children are excluded. Who's looking for them? And the interesting thing in this study is also that when you look at what the parents consider worthwhile, it's everything. There's nothing below that list, below that line of not worth using. So talking about the evidence-based medicine and what that has done for our profession, it's done a lot of good, but it's also done harm. And I do think that the 3 pillars, as Sackett thought them up, were meant to be equal, but somehow evidence-based medicine and methodological research has somehow become more important. And I'm not so sure that's really the case, because there's a lot of clinical expertise out there, and maybe researchers need to start asking clinicians and expert clinicians more. And the other thing is the patients have not been asked enough. And why is this important in this discussion? A patient can tell you so much through their skin. People that cannot communicate at all can communicate through their skin. So why not use that option? Pedro, of course, Pedro. Well, one of the things I didn't like about Pedro, but they have changed that, it was all English languages at first, but now there's at least 7 languages they do look at. So that's starting to change. So when I looked for anything related to touch, and as you can see, Fukui, who's done some really good research for skin movement, nothing to be found. Light personal touch, one systematic review or a Cochrane review of the importance of using massage in the really young infants. And then when you look at touch, many of the methods that we use, and these are the ones that are included in these 27, are about manipulation, are about putting your hands on a patient. And not saying that all of them say that they're all good and effective, but there are enough systematic reviews in the Pedro database. So what makes that skin so special? Why do I think we really need to know more about it? Because we, all of us, have learned to manipulate through it, to feel the muscle underlying or the ligament or whatever we were trying to find. And we never thought of using it as, and looking at it itself. We're not dermatologists, but we never really got the idea that maybe if we know more about skin, we can learn more about our patients. So what do we know now that is still not in the textbooks anywhere? Well, first of all, the epidermal skin cell changes under stretch. Not only volume changes, but the shape and size change. And they go back to their original shape after the stretch has been removed. That's Gimberteau, Dr. Gimberteau's work, and you can find his work online. The film that's online on YouTube and that you can view for nothing is called Strolling Under the Skin. He's the first one that has really looked at the skin and the underlying parts of the body microscopically, so really interesting research. Skin moves in specific directions, research by Foucault. Skin units are areas of skin, often described in the burn literature, that are part of a same movement. They haven't been really mapped yet, so that needs to be done. And then the realization that receptors involved in proprioception, we always think they're in the muscles and the joints. They're also in the skin. And they work top down and bottom up simultaneously, giving us extra information outside of the central nervous system, the peripheral and the autonomic. Meaning that if you do have a central neurological or peripheral problem, I can still use these receptors in the epidermal layer to give information to the brain. And the really interesting study that has been done recently has shown that the cutaneous nerves, which have been mapped by Diana Jacobs extensively, actually do, part of them disseminate inward again to underlying fascia and muscles, meaning that at the end of what we thought was the end of our touch receptors possibilities, that nerve actually goes back in, having contact with the region below, meaning they do tell us a lot. So the first time that anybody talked about skin receptors and them being in the skin and being just as important as muscle spinal afferents was in 1992 and 1994. And this is a really interesting and quite a large article that I suggest everybody read, because they have looked into the fact if mechanoreceptors do influence posture and how they influence posture and how they are influenced, and not only influenced through exteroceptive but also interoceptive stimuli. And so what I would like to share shortly with you, because you can look all these articles up, I will give you a reference list, is kangaroo care, skinning allowance for movement, the anatomy, touch research in adults, touch research in children, touch research about the mechanoreceptors and posture, and how the skin of your foot sole can influence posture as well, and even the positive effects of hands-on for learning. So very shortly about the kangaroo care, I really love this article and the conclusion that, because of course kangaroo care was being carried out by the mums at first, but now studies have shown that if it's dad or mum, it doesn't matter. There's no difference in responses for the children if there's the mum or the dad there. And what really matters is the skin contact. And in more research, it is shown that skin contact matters, even not only in us humans, but in animals as well. And I'm not going to talk about all the evidence showing the effects of massage. I presume you can look that up. So introducing Diana Jacobs, she is the first who's really researched the anatomy of the cutaneous nerves, wrote that in a book, and she has developed a concept and modality of treatment looking at using skin stretch and the knowledge of the cutaneous nerves to have effects on pain through self-regulation. So fantastic book that should be in everybody's library. And next to her was Fukui, Professor Fukui from Tokyo University, who researched skin movement. And his research shows that skin moves in a specific direction, changes direction in the midline, during rotation at least, moves from and to skin pleats or folds, is adhered to certain layers at certain anatomical sites, otherwise the skin would just droop off us, and stimulation of skin by stretch, by light skin stretch, does activate the underlying adjacent muscles. So let me share the video that he sent me showing this. This is part of his book that he wrote called Skin Taping, and part of his research. So look at this picture. The skin stretch was given 10, 20 centimeters higher than where the probe was. So this is this patient sitting there, flexing and extending the knee. Here you see the whole skin, and the whiter layers are the fascia around muscles, and you can see that there's muscles going, moving and going in different directions, thickening and thinning. And the next one, so that will be coming in a minute, please look at this area, because I'm so sorry, something is going wrong here. So if you watch closely, the skin is being stretched on the top layer here. See the skin being stretched? That's 20 centimeters up. And the patient is not moving now. It's just sitting there, not moving. So activating underlying motor units, but also muscle units and whole muscles adjacent to the stimulus. Now, this is Fukui again, showing that his skin method really can make a difference. So skin moves and allows for movement. So you've just seen him doing abduction in this young man, and this is just a healthy young student probably. And he's now putting a piece of tape around the ankle. And this is all based on his research. It's not just any place. And you will see that when he's applied that, abduction will increase. Skins stretched in the right place can really influence movement. You need skin to move to be able to do it. So let me very shortly go through all these studies that have been done. Light touch and the influence of balance has been looked at. And the interesting thing was that one of the markers was on C7. And it showed that light touch could really help when the eyes were closed to enhance the balance. And again, I'm not going to go into detail of all these articles. Please read them yourself. But the interesting thing is C7 as the marker, because what we had found is in other research, and as you know or don't know, I am the author of this book called Elastic Therapeutic Taping in Pediatrics, and it is a skin approach. And we had thought up, after we'd been reading this research, the new P-tape, it was called, we were calling it a placebo tape first, because it was actually copying the placebo tapes in these two studies, the first two. They used this as a placebo tape and found that this placebo tape was just as effective as the enormous pieces of tape that are usually used to address forward head positioning. But in the third study, they actually used this tape alone and showed that it could be really effective in forward head posture problems. Light touch really does make a difference. So in patients that are aging with skin, with brain lesions or other problems in their sensory system, really touching a surface with a fingertip can make a huge difference. They're closing the chain, but the fingertip has an enormous amount of mechanoreceptors and sensors that give the brain a lot of information. Same study here on a healthy population. It really does expand the means to increase balance, even if you have a visual loss. So in this case, they actually looked at the personal touch and the machine touch, and both work. This study looked at deliberate interpersonal touch in patients with Parkinson and stroke, and found that touch reduces sway in both groups. This study looked at the normal massage, but also the touch element, and as touch turned out to be better or more effective than the traditional approach. And haptic guidance during balance was shown to be effective in these older adults, and definitely decreasing the postural strain in standing. It also showed this study that people are responsive to social factors, which of course everybody is, so our children as well. So, and interestingly enough, these patients were blinded and got both therapies, and it was shown that both mirror therapy and touch observation were effective. And yes, again, another study on the effects of touch on sway. In this case, the patient was standing and touching again with one finger. So, and this one, because these are the ones about what they've done with children. So thankfully, we have a few of them as well. So in this case, they were looking at the visual and the haptic effects, and could that have a difference, make a difference in adults and children? Could that effect be different? And yes. Both or haptic information really does help the children control posture. And this study showed, and these were children with autism, that light fingertip touch reduced postural sway as well. And again, this light finger contact was done with another study as well. And again, light touch really decreases the postural sway and enhances detection. And then this study I thought, when I first read that, I thought, oh my goodness, we all know this. Why is this study needed? But thankfully, we can use it now, because this study really looked at what deliberate light interpersonal touch. And imagine it was the touch of a hand, so either on top of the head or in the neck or on the thoracic part, higher thoracic part of the back. And this touch, this was only touch during walking, showed that these children became more stable. And yes, let me talk about Phyta, because that's a very hands-on therapy. And why is it important for me? Because of the diaphragm, and the diaphragm being the most important muscle we have. And children with cerebral palsy often have weakness in the diaphragm. This study showed that Phyta is definitely an effective treatment to improve the diaphragm, but also sitting position posture. And another study showed, and this is the one position that I have used a lot as well. It suggests that this treatment is really good for the inspiratory or the respiratory situation and motor development and postural control. And then our foot sole. I was one of the people that wrote an article looking at all the literature there is, and that comes from our podiatry colleagues. Our foot sole gives our brain a lot of information. And activation of the foot sole actually, because many studies have been done to this extent with vibration, with all sorts of different stimuli, have shown that actually can activate muscles in the trunk. So yes, I translated that into a tape, but we know that cutaneous information coming from the foot sole gives us information about posture and locomotion. We've known that for a while. So this is the transverse arch tape that was developed because of the research, hypothesizing that if these points that I mean, the ones, the little spots in blue, have a whole cluster of mechanoreceptors in the skin. If those areas are stimulated in some way, then that would have an effect. And yes, it does. And this study, very short study of mine, shows that. And then, as I said, even in learning, hands-on can be more effective. This was in an article in an OT journal, suggesting that hands-on enhances sensory and perceptual experiences and is successful for learning. So people, please, skin really matters. It's an immensely important body structure. It has long been underestimated. Our hands, your hands, are the most amazing tools for assessment. The patient's skin is the most amazing place to get some information. Skin allows movement. So make sure you know the anatomy of cutaneous nerves, because knowing them and the dermatomes comes in very handy for treatment. If we do not touch, we will miss important information, including maybe the scars. The more you know about body structure, the more you can do. Hands hands-on allow for us to contact the brain directly. It allows personal response to that stimulus. It's the patient's way of telling us if what we are doing is harming them, yes or no, or is beneficial, preferably. So can you imagine why I really, really think we should not ever stop touching? Please, if you do have any more ideas, ask questions, contact me, challenge me, but please, please, please keep hands on. Thank you very much and stay safe.